Hello and thank you for your interest in the Administrative Fellowship at UTMB. This presentation will provide information regarding UTMB Health and the Administrative Fellowship Program at the University of Texas Medical Branch in Galveston. My name is Stephanie Katzenmeyer, and I am the current Administrative Fellow for the UTMB Health System. I completed my Master of Healthcare Administration and Master of Business Administration at the University of Houston-Clear Lake. During graduate school, I worked as a medical technologist at Kelsey-Seybold, where I managed the daily operations of the clinical laboratory. I was also an administrative intern last summer at Intermountain Healthcare, where I became part of multiple projects in operations and continuous improvement.
My name is Adriana Rodriguez, and I was the Administrative Fellow from 2021 to 2022. After completion of my fellowship, I transitioned into my current role as Service Line Operations Manager, reporting directly to the VP of Health System Strategy. I completed my Master of Healthcare Administration and Master of Business Administration at Texas Women's University.
During this presentation, we will discuss UTMB's organizational history and complex structure. We will also cover the administrative fellowship structure, preceptor, various types of projects the fellow has the opportunity to be involved in, and the application process. UTMB has had over 40 successful fellows, and some of the executives and directors are former fellows from various institutions. Additionally, the institution's employees reflect the diverse population it serves. Despite the global pandemic, UTMB is in a time of system-wide growth, allowing the fellow an opportunity to work on a variety of projects. Fellows will have continuous exposure to the executive team and the opportunity to network with other Texas Medical Center fellows.
The city of Galveston, Texas is home to UTMB's Academic Medical Center. This is where our main campus and administrative hub is housed. There are two major industries in Galveston: tourism, as the island is rich with history and culture, and healthcare. The summers are the busiest time for both. Patient volumes typically peak from June to August. UTMB is located only 50 minutes outside of Houston, so employees are able to experience both island and city life. Galveston is also home to 32 miles of beaches and numerous events and festivals, such as the largest Mardi Gras celebration in Texas. UTMB also serves the greater Houston area south of the Loop, known as the Bay Area. Clear Lake and Link City are located only 30 minutes outside of downtown Houston, where residents have easy access to enjoy what the city has to offer. Houston is home to diverse cultures and a wide variety of shopping, entertainment, and dining options. With no shortage of activities and a low cost of living compared to other populous cities, the Houston area is a great place to live. The mission of UTMB is to improve health for the people of Texas and around the world. This is done by offering innovative education and training, pursuing cutting-edge research, and providing the highest quality patient care. UTMB's vision is to work together to work wonders, while living out the values of compassion, integrity, respect, diversity, and lifelong learning. UTMB is comprised of 5 schools and home to the nation's first public medical school, which is one of the largest in Texas. The institution currently serves over 3,000 students and has increased enrollment to meet the nation's healthcare needs. UTMB receives about $200 million in grants and contracts for research purposes. The UTMB campus includes the Galveston National Lab, one of 2 biosafety Level 4 labs in the U.S. The Galveston National Lab is working on developing vaccines for many of the world's infectious diseases, including the Zika and Ebola viruses. Of course, the Galveston National Lab conducted research and development related to COVID-19 and continues to do so. In fact, it was the first reference laboratory in the world to distribute the first virus isolate to distribute RNA for diagnostic development and test validation. UTMB Health is a large and growing health system of comprehensive services. UTMB Health is designated as the only Level 1 trauma center in Galveston County and one of 3 in the Texas Medical Center. We advance patient care by using technology, research, and innovative care models to improve health outcomes for the population we serve. UTMB has an extensive telemedicine program used for research and patient care. This allows us to provide care to patients at correctional facilities throughout Texas, on cruise ships, in Antarctica, and community clinics for the underserved. As the Region 2 anchor for the Medicaid 1115 waiver, we help support the establishment of regional healthcare partnerships to improve the ability of other health organizations to meet community needs. This map illustrates the expansiveness of UTMB throughout Texas. In addition to the care we provide in the Bay Area, we also have correctional managed care in regional women's and pediatric clinics throughout the state. After Hurricane Ike in 2008, UTMB began growth strategies for delivering care to the mainland. This map illustrates the hospitals and clinics that have opened as of March 2019. UTMB now has 4 campuses, the Academic Medical Center in Galveston, and 3 regional hospitals in the Bay Area. Those 4 campuses make up 6 hospitals, and there are 91 outpatient clinics across Galveston, the Bay Area, and Brazoria County. One of UTMB's many unique attributes is that we are home to Hospital Galveston, the only hospital in the nation that is focused solely on offender care. Our economies of scale, combined with advanced telemedicine, allows us to provide an extremely efficient model of care, resulting in the annual spend per offender to be 30% below the national median, making us the most cost-effective in the nation.
The Angleton-Danbury campus provides a variety of quality services such as an ACR-accredited mammography program, cardiopulmonary clinical laboratory, diagnostic imaging services, outpatient surgery, rehabilitation, physical therapy, and 24-hour emergency services. Renovations to the emergency department are currently underway. UTMB's League City campus, complete with inpatient and outpatient care, medical and surgical specialties, expanded hours urgent care, and a 24-hour emergency department, is located about 30 minutes north of Galveston in a growing community and is in partnership with MD Anderson for oncological care. To serve the growing demand of the market, the League City campus completed an interior renovation in addition to an expansion in March 2020 that features 2 ancillary floors and increased the hospital's capacity to treat up to 97 inpatients. The expansion also added a 750-stall parking garage, a medical plaza building, and a conditioned sky bridge to connect the garage to the hospital. Plans are already in the works to continue expanding. In March 2019, UTMB Health began operations at our Clear Lake campus, allowing us to further expand our reach onto the mainland. This facility offers a comprehensive range of services such as endocrinology, labor and delivery, orthopedics, cardiovascular care, neurosciences care, and more. UTMB is finalizing a plan to build a helistop and continues to expand services at this campus in order to be designated as a Level 2 trauma center. There will be opportunities for the fellow to get involved in projects and rotations at our regional hospitals, such as this campus. UTMB opened the new Jenny Seeley Hospital and Clinical Services Wing in 2016. The hospital features 310 patient rooms, including 60 highly advanced ICU beds and 20 state-of-the-art operating suites. The construction of this hospital has provided the necessary clinical capacity needed for the Phase 3 modernization of John Seeley Hospital. The original John Seeley Hospital opened in January of 1890 and became affiliated with UTMB 1 year later. The current John Seeley Hospital building was built in 1978 and now serves as the hub of inpatient care for women's and children's services. A major renovation is underway, which includes significant interior redesign as well as replacement of the building's facade and covered driveway. At the expected completion of the project in 2022, women's and children's inpatient care will be fully consolidated from adjacent buildings into the John Seeley Hospital with expanded capacity for pediatric patients and mothers and babies. As previously mentioned, Galveston's main campus has been home to the Texas Department of Criminal Justice Hospital Galveston since 1983. This is an acute care facility that provides inpatient and outpatient services for Texas inmates within the confines of a secured environment, staffed by TDCJ officers. Hospital Galveston has a whole floor dedicated to ambulatory clinics, as well as 138 patient beds and 57 infirmary beds. The fellowship at UTMB is a year-long program which will begin in the summer of 2023. Our fellowship program uniquely caters to the interests of the fellow. The Administrative Fellow participates in the day-to-day health system operations and works closely with an accomplished senior leadership team on a wide array of projects and initiatives. Mentorship and building relationships with UTMB enterprise leaders are strong components of our program. Fellows have significant exposure to the executive team and are expected to attend and participate in weekly executive meetings, health system executive leadership retreats, and project work with executives and next-level leaders. Additionally, the Fellows Office is located in the administrative suite of Jenny Seeley Hospital, which provides daily access to the executive team. To foster professional development of the Fellow, UTMB allows for travel to one conference over the course of the fellowship. The preceptor for the UTMB Administrative Fellowship is Beth Vengato, who is the VP of Health System Optimization and Performance. Beth works vertically throughout the system to ensure that locations, services, and other patient interactions are aligned and seamlessly coordinated. She provides a wealth of expertise related to outcome reliability, process improvement, change management, and use of management systems. Beth is results-focused, highly qualified change catalyst and lean sensei with more than 20 years of experience that complements UTMB's best care and high-value practicing organization efforts. Prior to arriving at UTMB, Beth led the strategic support services and lean systems at Denver Health for 7 years. As the fellowship preceptor, Beth engages with and supports the fellow as she helps them navigate through their experience. This slide gives an overview of some of the projects I have started on and some opportunities I've had within the first month of my fellowship. My goals for this year include gaining a better understanding of UTMB's complex system and structure, managing valuable projects that provide me with further leadership experience, and building significant relationships that will assist me in my healthcare journey. I have enjoyed the continuous high-level exposure, and I hope to learn more about the process improvement, operations, and business development side.
This slide shows a few of the many projects and activities I was involved in throughout my fellowship. I had many opportunities to facilitate lean events in areas across the enterprise, which gave me immediate exposure to current operations, as well as coaching how to use process improvement tools. One project that I am most proud of is the standing up of our bariatrics and obesity medicine program. Towards the end of my fellowship, I focused majority of my time working with the VP of Health System Strategy on developing a patient-centered service line structure to promote systemness and achieve key strategic objectives, which ultimately led me to my current role. Most notably, I gained experience in provider relations, vendor management, project management, business development, and strategic planning.
To apply for the fellowship, a complete application packet must be submitted by September 12, 2022 to Human Resources. The packet should include the application checklist, which can be found on the UTMB Administrative Fellowship website, a cover letter, resume, personal statement, graduate transcript, and 3 letters of recommendation in one PDF. This file should be attached to your application. We will review the applications after the September deadline and conduct phone interviews late September, and subsequently have on-site interviews early to mid-October. For more information, please visit www.utmb.edu/administrative fellowship. This concludes our presentation. If you have any questions, please contact me at the email or number listed on the slideshow. Thank you for your interest in the Administrative Fellowship at UTMB.